Let's break those apart. OCD, let's start with that. OCD is really characterized by experiencing distressing, unwanted, intrusive thoughts, images, or urges, and then that are followed by a behavior that's designed to get rid of the distress or to provide relief associated with those thoughts, images, or urges. Those behaviors are often called compulsions or rituals, and that's really the characterization of the OCD cycle. We experience that anxiety, we want to get rid of that anxiety, but the way we do that typically keeps us stuck. So complex anxiety really just refers to the idea that a lot of people struggle with more than one anxiety disorder. So our OCD and complex anxiety program treats OCD as well as all anxiety disorders. Additionally, we also treat trichotillomania and excoriation. Trichotillomania is often referred to as hair pulling, and excoriation is often referred to as skin picking. So anxiety disorders can include panic disorder, agoraphobia, social anxiety, any phobia really, generalized anxiety, illness anxiety, and separation anxiety. Panic disorder is when someone has recurrent, unexpected panic attacks that come on suddenly, and then they also experience either recurrent worry or concern about having additional panic attacks, or they change their life in a way that is not effective for them in an effort to avoid having additional panic attacks. Panic attacks are themselves characterized by an intense rush of physical symptoms that come on suddenly and can reach a peak within a few minutes. Panic attacks typically last for about 20 to 25 minutes, and they can reoccur throughout the day or the night. Common symptoms of panic can include having a pounding heart or racing heart, feeling shaky, feeling shortness of breath, feeling dizzy, feeling kind of detached from their body or mind. Somebody struggling with panic disorder might notice that they've altered their life in a way that is not really working for them. Common examples of this are avoiding going out into public, particularly during busy times, or changing up your social routine where you're avoiding things that you weren't necessarily avoiding before. Another common experience is that somebody with panic disorder might notice that they're going to the ER thinking that they're having a heart attack or a physical health issue and being turned away and being told that that's actually anxiety-based. This is a good question. So technically, these are interchangeable terms with a caveat. So panic attacks are really defined by the experience of those uncomfortable physical symptoms, whereas with anxiety, it can accompany uncomfortable physical symptoms. Anxiety itself is really characterized by experiencing fear and worry about a variety of situations. So in our program, we actually try to refrain from the use of the term anxiety attack, just to help people differentiate between a panic attack and their experience of anxiety, because anxiety itself is not attacking us, even though it can be very uncomfortable. Anxiety is really just trying to protect us, and we don't want to perpetuate this idea that anxiety should be feared. I thought about this a lot. I think the biggest diagnosable kind of sign of something like OCD or an anxiety disorder is feeling like fear is in the driver's seat of your life. If somebody notices that they're making decisions out of fear, or avoiding situations out of fear, or doing something over and over again out of fear, that is an indicator that you may be struggling with OCD or an anxiety disorder. Another common symptom is having a difficult time sitting with the unknown, uncertainty. The uncertainty for all of us is scary, but if we notice that we have a hard time tolerating that, that can be an indicator that might let us know, this might be bigger than just feeling a little anxious or feeling a little worried. That, for example, a lot of people with an anxiety disorder note that they spend a lot of time ruminating or worrying about something that tends to be focused on a what if or the unknown. So panic disorder is diagnosable when somebody experiences recurrent, unexpected panic attacks and either significant concern or worry about having additional attacks or have modified their life in a way to try to avoid having additional attacks. I think a big factor, that kind of ties into all of that is just that your life is impaired, right? Your life is impacted. If somebody notices, it's not just that I have a panic attack and I keep going with my life and I can move on easily. If you're feeling stuck, overwhelmed, your life is being altered as a result of these attacks, that might be an indicator that you could be diagnosed with panic disorder. The one thing that I wish everybody knew and really felt was that there is nothing to be ashamed of for seeking mental health treatment. Just like our physical health, we all have our own unique mental health. And our society has struggled historically to understand and to support people who struggle with their mental health, which I would argue is all of us. So it's changed a lot now and it's continuing to evolve. And there's so much support out there, whether it be coming to Compass or whether it be with an outside therapist or a support group. I would really encourage people to seek that support because particularly with anxiety, again, we kind of think, oh, I'm just anxious. We have that, sometimes we have that, I got to pick myself up by my bootstraps mentality. And that isn't necessarily effective for us and doesn't necessarily feel good. So if you are struggling, I would really encourage you to seek support because you deserve it and we all deserve it.